Now, this one I thought was probably the most interesting because I think a lot of people don't know this one. So, which of these statements about GLP-1 receptor agonists and thyroid cancer is most accurate? One, all GLP-1 receptor agonists significantly reduce the risk of thyroid cancer. All GLP-1 receptor agonists significantly increase the risk for thyroid cancer. Only liraglutide, which is better known as Saxenda, is associated with an increased risk for thyroid cancer. Or all GLP-1 receptor agonists have no effect on thyroid cancer risk.
I have to say the fourth.
No, it's the third, associated with an increased risk for thyroid cancer. It's still on the market. It just has a warning label saying there's a slight increase of thyroid cancer.
Well, and I wanted to ask this because I'm seeing this all over Instagram, and sometimes I
Right.
wonder if it's why are people reporting this and it's all over the
And why are people scared? And why are there billion-dollar lawsuits? And why? So, exactly. You can't always believe what anecdotally people say or fearmonger. You have to look at what the evidence shows. So it says a study found that semaglutide and related medications were not associated with a higher risk of ischemic optic neuropathy or its non-arteritic form over multiple years of follow-up. The cumulative risk remained very low and comparable to patients using other treatments. When you have a drug that is used so often, when you have 1 in 8 Americans using a drug, you're going to see some things.
right.
So many people are on Ozempic that you're going to see associations. You have to figure out if association is the same thing as causation. And
You're
I
not
was going
putting
to say how sometimes like a big criticism was, we just didn't have enough long-term safety data. We just don't have enough. But then these same people that are complaining about that are shooting themselves up with compounded semaglutide and are taking peptides. No safety data on that either, but it just depends on what aligns with what you deem important